Let us discuss about types and characteristics of hearing impairment today. All the nations have a universal dream of educating all the people. They work hard to actualize the dream. Special attention is paid to the persons with hearing loss or the disabled. While discussing all disabilities, hearing disability has a unique situation which may make the inclusion process slow and difficult. With other disabilities in general, language and communication are not the primary concerns. But in hearing disability, language and communication play a significant role. On the other hand, inadequate language and communication have the potential to negatively impact almost all development aspects of a child. Also, when it is not treated properly, it may affect the relation of the child and the family. Hearing impairment will be turned into a hearing handicap when they do not get adequate support from the family, school, or from the social community. A human being is a machine that produces thoughts, languages, ideas, feelings, opinions, views, etc. The intelligence of the person depends upon the sensory activities like hearing and speech. Hearing is the part of life of the person who can hear cannot talk, think of life without hearing. Hearing is an automatic process which can be done simultaneously with other several activities. This means that the functioning levels of the individuals with hearing impairment can be very different from each other. Hearing impairment means the inability of a person to hear as a normal person. Hearing is important because with hearing people can be aware of signals, sounds that ensure safety and security, constantly provides the people with information about the surroundings and help people acquire language, keeps linked with each other. It is the system that provides the sense of hearing, so it is important to know in detail about these sensory systems which will help to understand the steps involved in hearing process. This system consists of a ear and the auditory nerves which connects the brain and the ears. The ears consists of three parts. They are 1. External ear. It consists of the ear canal and the pinna. It is the outer structure which is visible to us. The outside sound just hits the pinna and gets reflected so that the brain recognizes the sound and identify the direction of the sound transmitted. The transmitted sound gets into the tube which is also called as auditory canal, and this canal check the decibel of sound and then amplifies it and sends it into the eardrum. It is the starting of the middle ear. Usually the sounds are measured in decibels. When greater decibel sounds enters, it damages the eardrum. There are also small hairs present which prevents the outside dust from entering into the ears. Middle ear. The middle ear is placed internally to the eardrum. It usually couples the sound transmitted by air through an oval window which is made by the principle of mechanical advantage. A footplate commonly known as stapes forms the vibratory portion of the eardrum. These stapes are a bone which is attached to the oval window. The sound collected is entered into the canal and hits the eardrum, and concentrated on this footplate, the force is increased and the velocity is being decreased, so they couple with acoustic energy. It can also control the noise transmitted to a certain level. It allows some contraction methods which result in reducing the decibel of noise transmitted. The middle ear muscles follow these contraction methods, so help in preventing the damage of the eardrum. These middle ear muscles are ossicles. The ossicles consist of tiny bones which are given Latin names for their shape. They directly send the sound from the eardrum to the oval window. Number 3. Internal ear. It consists of the cochlea, many non-auditory structures. The cochlea consists of 3 sections which are filled with fluid. These fluid waves are driven under pressure by the basilar membrane, which separates the sections. One of the section is the cochlear duct, which contains a fluid which is similar to the intracellular fluid in the cells. Other 2 sections are scala tympani and scala vestibule. They are in turn located on a bony membrane and filled with a fluid called perilymph, which is similar to cerebrospinal fluid. The composition of these 2 fluids is important for the functioning of the middle ear. Thus, the above information helps to describe the general outline of ear functioning and their composition. As you all know, hearing impairment is the serious problem that affects children of all ages. It has some specific characteristics. Even though the degrees of loss vary among children, some characters indicate the hearing difficulties. Delay in speech. Delays in the development of speech and language are the symptoms of hearing loss in children. Children not speaking till the age of 2 is likely to be affected by hearing loss. Child with normal hearing capability is able to recognize the names of family members by 2 years of age. Children with poor hearing feel it difficult because they don't understand the speech. When diagnosed in early stages, children get solved. Difficulty in communication. Children with mild to moderate hearing impairment may develop speech and language like others to some extent, but also they struggle to communicate and speak normally. Hearing the selective. It is a fact that many children who ignore their parents are unable to hear them. Hearing impaired children are often unable to hear their names when called, and their behavior can be mistakenly labeled as inattention or behavioral misconduct. A hearing test or developmental evaluation can help to determine the cause or nature of child's selective hearing. Behavioral characteristics. Deaf and hearing impaired children can develop a variety of behavioral symptoms. Many children will turn up TVs or radios to high volume to compensate for their sensory challenges. Children struggling with deafness may also closely watch others to imitate the behavior and body language. Academic problems and irritability are also common symptoms of hearing loss in children. Differential diagnosis. Some children having the characteristics of hearing loss might suffer from unrelated disorders. Behavioral and emotional disturbances can cause speech delays and social difficulties, which might be mistaken for challenges with hearing or sensory processing. Autism also occurs with many symptoms similar to hearing loss. Only a professional evaluation can correctly identify the cause of these symptoms and characteristics. Characteristics of hearing impaired individuals: lack of attention, no reaction to low voices, uses sign language, lack of speech development, works best in small groups, voice quality is low, not active, following difficulty, offered with things rather than people, imitates others, responds to noises instead of words, reluctant to participate orally. The achievements of these children are deployed by some other environmental factors which are to be checked, like if the child is being treated the right way, if the child has gotten any hearing aids connected that makes possible hearing, if the child is made familiar to sign languages for better communication, if the child is made to communicate at the early stage itself or not, if the child is being cared by the family or not, if the hearing aids given suits them properly, and also whether the child is able to hear properly with that or not. If the child has got any neighbors or friends to communicate, which will in turn develop skills. If the child is being affected by any other disabilities also. If the child is admitted into the appropriate school or not. When all the above environmental factors are being treated and checked, the child will recover early from hearing loss to compete with the normal person. The most important period for language and speech development is generally regarded as the first 3 years of life. It is the sensitive period. Although there are several methods of identifying hearing impairment, during the first year, the average age of identification remains close to 3 years. Lesser degrees of hearing loss may go undetected, even longer. The result is that for many hearing impaired infants and young children, much of the crucial period for language and speech learning is lost. There is a general agreement that hearing impairment should be recognized as early in life as possible, so that the remediation process can take full advantage of the plasticity of the developing sensory systems, and so that the child can enjoy normal social development. Audiologists are among a team of hearing healthcare professionals who work to identify and assess disorders of hearing and balance in both pediatric and adult populations. If hearing loss is identified as impacting the patient's life, the audiologist can also recommend, select and fit appropriate amplification devices. Additional assessments may also be needed to find out if the patient is a cochlear implant candidate or could be helped through other hearing assistive listening devices or assistive listening technology. Identification of hearing loss has never been easier than it is now. Patient populations of all ages and developmental levels can be tested subjectively or objectively to provide information about the function of their auditory system. Specialized testing for difficult to test population has become more widely accepted and is able to be performed safely and easily. Some or all of the following tests may be performed to assess our auditory system. Pure tone audiometry. It is the key hearing test used to identify hearing threshold levels of an individual, enabling determination of the degree, type and configuration of the hearing loss. PTA is a subjective behavioral measurement of hearing threshold, as it relies on patient response to pure tone stimuli. Therefore, PTA is used on adults and children old enough to cooperate with the test procedure. PTA only measures thresholds rather than other aspects of hearing such as sound localization. However, there are benefits of using PTA over other forms of hearing test such as click auditory brainstem response. PTA provides ear specific thresholds and uses frequency specific pure tones to give place specific responses, so that the configuration of hearing loss can be identified. Speech audiometry. Speech audiometry has become a fundamental tool in hearing loss assessment. In addition, with pure tone audiometry, it can aid in determining the degree and type of hearing loss. Speech audiometry also provides information regarding discomfort or tolerance to speech stimuli and information on word recognition abilities. In addition, information gained by speech audiometry can help determine proper gain and maximum output of hearing aids and other amplifying devices for patients with significant hearing losses and help assess how well they hear in noise. Speech audiometry also facilitates audiological rehabilitation management. Otoacoustic emissions. Otoacoustic emissions are acoustic signals generated by the normal inner ear. either in the absence of acoustic stimulation or in response to acoustic stimulation or electrical stimulation. Acoustically evoked acoustic emission testing allows the audiologist to understand how the outer cells of your inner ear are working. There are three types of autoacoustic emission testing: 1. Spontaneous, 2. Transient, and 3. Distortion product. Auditory brainstem responses can be used to screen for hearing impairment in newborns, since ABRs do not require a voluntary response and can be done without sedation. This screening test is highly sensitive. Nearly all children born with significant congenital hearing defects should be detected in the newborn nursery using ABR and can be referred for further evaluation. Since ABR screening and follow-up are expensive and retrained personnel, this method has been applied principally to newborns that are at risk for hearing impairment. Newer automated ABR technology and innovative analysis schemes may diminish costs. Hearing in noise test. It is used to measure the person's ability to hear speech in silent and in noisy situations. During the test, the patient uses both the ears together to repeat sentences. They repeat the sentences in noise and also quiet situations. This test is for three groups. The first group is for normal hearing individuals and mild hearing loss people, and the second is the peace officers with hearing impairment. The third is for hearing aid users. Thus, the above tests are performed to identify the hearing loss. Types of hearing loss. There are four types of hearing loss: central processing disorder, conductive hearing loss, mixed hearing loss, and sensory neural hearing loss. Central auditory processing disorders. It occurs when the brain has some problem in processing the sensation of sound. One of the biggest problems experienced by individuals is difficult to listen sounds in presence of background noise. It may result in a diminished ability to localize sound, discriminate and recognize auditory patterns, and deal with degraded or competing acoustic signals disorders. Generally occurs when the parts of the brain that interpret sound are affected by injury, disease, tumor or other unknown causes. Conductive hearing loss. Conductive hearing loss happens when there is a problem with the outer or middle ear. It is the state in which the sound waves are not properly conducted through the root. The root is defined as the conduction of sound from the external ear passing through the eardrum, not properly reaching the middle ear. This type of hearing loss may occur with other losses or alone. It also involves a reduction in hearing sounds, that is, when prone to hearing loss. Some small sounds are not heard. The speaker need to express louder so that the listener hears it. It can be caused by an earwax, an ear infection, a punctured eardrum, a buildup of fluid or abnormal bone growth. It is more common in children. Medical interventions and technologies are often used to treat conductive hearing loss. Technologies such as bone hearing devices or bone conduction hearing devices can help reduce the effects of conductive hearing loss. Sensory neural hearing loss. This type of hearing loss occurs when the inner ear is being damaged. It results in abnormal functioning of central auditory system in the brain, commonly called central hearing impairment. So the sound may transmit back and forth on either side of the brain. It occurs when the part of the ear that transforms sound to electrical information and sends the information to the brain is damaged or malfunctions. It can be genetic or caused by the natural aging process, diseases or exposure to noise and certain kinds of chemicals. Managing exposure to the damaging noise prevents noise-induced hearing loss and limits further loss of existing hearing. Auditory neuropathy is a form of sensorineural hearing loss where the auditory nerve is damaged or malfunctioning arises. Technologies like hearing aids, cochlear implants can reduce the effects of sensorineural hearing loss. Mixed hearing loss. This type of loss may be a combination of the above two types or with sensorineural hearing loss. The sensorineural component of the hearing loss is permanent, while the conductive component may be permanent or temporary. It may affect the eardrum or the middle ear or even damage the both. In case of dry ear conduction aid can be tried, or draining ear, the bone hearing aid is used. It is explained as a mixed hearing loss can occur when a person with age-related hearing loss also has a middle ear infection. Causes and prevention of hearing loss. There are three types of hearing loss. So, the causes of these losses will appropriate the cause of hearing loss as a whole. Conductive hearing loss. Conductive hearing loss can be acquired or congenital and is caused by damage in the outer or middle ear. A conductive hearing loss leads to non-hearing of lower voices and can often be helped by medical or surgical treatment. Some of the causes of conductive hearing losses are blockages of the ear canal by wax or foreign objects, outer ear infection due to swimming, etc. Middle ear infection, a common problem in young children, usually known as a glue ear. Perforated eardrum due to middle ear infection or an accident. Otosclerosis, a condition which is hereditary where the bone grows around the tiny bones in the middle ear. Partial or complete closure of ear canal. Sensory neural hearing loss. This type of hearing loss occurs when the inner ear is damaged. This type of hearing loss results in abnormal functioning of central auditory system in the brain, commonly called central hearing impairment. So, the sound may transmit back and forth on either side of the brain. This type of hearing loss results in abnormal functioning of central auditory system in the brain, commonly called central hearing impairment. So, the sound may transmit back and forth on either side of the brain. It leads to a loss of loudness as well as lack of clarity. The quantity and the quality of sound are affected and sometimes may limit the benefit of a hearing aid as well. Causes of acquired sensorineural hearing loss include aging, excessive exposure to noise, other viral diseases, drugs that damage the hearing system, head injuries, poor functioning of hair cells, no hearing protection, mixed hearing loss. This type of loss may be a combination of the above two types or with the sensorineural hearing loss. It may affect the eardrum or the middle ear or even damage the both. Causes: ear infection, defect in the eardrum. Mostly it can be cured only with the surgery, but surgery is not always successful. A sensory component is added that will manage the conductive loss. Prevention of hearing loss. Hearing is an important sense for communication. A major part of all learning takes place through hearing. Therefore, a downslope in the person's ability to hear can severely affect their life. Hearing loss can be caused by several factors, some which occur even prior to birth and some which cause hearing loss to set in later. Hearing loss may even be hereditary, but in several cases, hearing loss can be prevented. Here are a few guidelines on how you can protect your hearing. Avoid marriages among close relatives. Immunize women in child bearing age against rubella. Ensure good health of mother by health checkups at regular intervals. Expecting mothers should avoid contact with persons suffering from infectious diseases. The child immunization schedule should be properly followed. Maintain a ear hygiene. Avoidance slapping or blowing into the ear which cause hearing problem. Children playing with tiny objects like beads, seeds, etc. If they put them in the ear, the eardrum may get damaged or ear canal may be damaged. Putting oil or any other liquid in the ear will cause pain or swelling in the ears. Avoid swimming in dirty water. Using cotton on the ears while swimming can prevent water entering into the eardrum. Avoid using unwashed pillow covers, towels, etc. used by a person with ear discharge. This may cause infection in their ears also. While feeding the baby, the head must be raised, so avoiding milk entering into the canal cavity through the small passage connecting the throat and the ears. It can cause pain and swelling in the ears. Avoid exposure to loud sounds. Avoid taking medicines without doctor's advice. So to conclude, we have discussed most of the information about the hearing loss is discussed and also the characteristics of hearing loss. It is found that in most of the hearing impairment cases, the deafness are preventable. Many preventive measures are there like proper immunization and listening to low density voices and allow lesser noise into the ears. It is found that in most of the hearing impairment cases, the deafness are preventable. Many preventive measures are there like proper immunization and listening to low density voices and allow lesser noise into the ears. Listening to less noise is an important preventive measure. Children should be advised in childhood itself to have lesser exposure to loud noises. Variations in causes, onset, degree and type of hearing losses as well as family and educational situations result in a widely diverse hearing impaired population. However, students with auditory impairments characteristically experience significant issues with regard to social and intellectual development, speech and language and educational achievement. Teaching methods must include most of the new techniques in the field and also monitor whether the objectives are achieved. In India, there are expectations also that allow unimpaired to take the required language, which reduces the pressure in them and develop their skills naturally. It is the family who should support the children and not put in stress and admit them in the appropriate school so that they gain proper education. There is no doubt that these children have a wide range of knowledge, but does not get the field of competing with the normal. So when trained, they explore themselves in the heights. Much educational programs should be conducted so enhance their level of education. For children who are deaf or have severe hearing losses, early consistent and conscious use of visible communication modes such as sign language, finger spelling and cued speech under amplification and oral or oral training can help reduce this language delay. The hearing impaired people should not be treated negatively, which in turn affects not only their education but also their personal life. In the above educational methods, we have come through some concerns which may act as barriers, so they must be resolved.